Millions of people are taking Ozempic, Wegovy, and Mounjaro right now. Most of them went in knowing about the nausea, they knew about the stomach issues. Some even braced themselves for the physical changes that come with rapid weight loss. But nobody warned them about this. There is a side effect spreading through GLP-1 communities online that doctors are only just beginning to talk about publicly. It is invisible. You cannot see it in a photo. It will not show up in a mirror. But for the people experiencing it, it is so relentless and so hard to stop that some users are saying it is worse than anything else they have dealt with on these medications. By the end of this video, you will know exactly what it is, why it happens, and what you can actually do about it if it is happening to you right now. First, a little context. GLP-1 receptor agonists are drugs originally developed for type 2 diabetes that have exploded in popularity for weight loss. Ozempic and Wegovy both contain semaglutide. Mounjaro and Zepbound both contain tirzepatide. They work by mimicking a hormone that suppresses appetite, slows digestion, and regulates blood sugar. Prescriptions have surged globally, celebrities have spoken openly about using them, and alongside all of that growth, a well-documented catalog of side effects has built up over time. The gastrointestinal effects like nausea and stomach pain are the most common and most discussed. Then there are the appearance-related changes that have gotten colorful names. Ozempic face, Ozempic butt. These come from the speed and degree of fat loss the medications produce. But now something new is being reported. Something that has nothing to do with how you look. People are itching. Not a little, not just around the injection site. We are talking about persistent, whole-body itching that some users describe as unbearable. And the reason this side effect is getting so much attention right now is that it is both invisible and relentless. Unlike nausea, which tends to fade as your body adjusts to the medication, or the physical changes that come with weight loss, this one can appear suddenly, worsen over time, and feel completely disconnected from anything else going on in your life, which makes it incredibly confusing and frustrating to deal with, especially when your medication is otherwise working exactly as intended. On Reddit, in communities dedicated to Ozempic and semaglutide users, posts about this have been piling up. One person wrote that since starting the injections, they developed spots on their back and arm that itch continuously, no matter how much they scratch. Another described wanting to claw their legs and forearms to the point of drawing blood, saying it had gotten progressively worse with each injection. A third reported severe itchiness over their entire body from head to toes, starting shortly after beginning the medication. Now here is where it gets medically interesting. According to Dr. Ann Peters, an endocrinologist at Keck Medicine of USC, clinical trial data shows that skin-related issues are reported by 3 to 8% of GLP-1 users. That might sound small, but given how many millions of people are currently on these medications, that represents a very large number of real people dealing with a very uncomfortable problem. Dr. Peters describes the reaction as either a response to the chemical compound in the medication itself or to the physical act of injection. And that distinction matters because it points toward very different causes and very different solutions. Board-certified dermatologist Dr. Hadley King explains what is happening at the skin level. When any medication is injected subcutaneously, meaning under the skin, the body responds to two things at once: the physical trauma of the needle and the introduction of a foreign chemical into the tissue. The local immune response that follows can produce redness, swelling, and itching around the injection site. This is a normal reaction to any subcutaneous injection and is not unique to GLP-1 drugs. If the itching is localized to where you inject, there is a straightforward fix that is frequently overlooked. Rotate your injection sites. Dr. Peters is clear on this. Some areas of the body are more sensitive than others, and repeatedly injecting the same location causes that tissue to become progressively more irritated over time. Moving between the abdomen, the thigh, and the back of the upper arm, and giving each area time to recover, reduces the cumulative irritation that drives localized itching. Many users settle into one convenient spot without realizing they are re-traumatizing the same patch of skin every single week. A simple rotation chart, even just a rough mental map of where you injected last time, can make a surprisingly significant difference in how your skin responds over weeks and months of consistent use. But here is the part you really need to pay attention to if you are currently on one of these medications. Not all GLP-1 related itching is localized. When the itching is widespread, spreading across your legs, arms, and torso, occurring in areas nowhere near where you inject, and feeling like it is coming from inside rather than the surface of your skin, that is a different category of reaction entirely. That may indicate your body is having a sensitivity response to the drug compound itself as it circulates systemically through your bloodstream. This type of reaction can present alongside hives, blistering, or diffuse itchy patches that spread and shift around the body. These are signs that the immune system is reacting to the medication at a broader level. Dr. Peters is unambiguous about what to do in this situation. Stop taking the medication. Do not push through it. Stop the injections. Allow the itching to subside, and contact your healthcare provider before doing anything else. A dermatologist or allergist can assess the reaction and determine whether it is safe to resume, whether a dose adjustment might help, or whether a different medication in the same class could be better tolerated. And if the itching comes with difficulty breathing or swallowing, that is not a YouTube video situation. That requires urgent medical attention immediately. For everyone experiencing milder but still disruptive itching, have an honest conversation with your prescribing doctor. Many people stay silent about side effects that feel minor, not wanting to seem like they are complaining about a medication that is otherwise working. But your doctor cannot help you manage something they do not know about. Describe where it occurs, when it started, how severe it is, and whether it correlates with the timing of your injections. GLP-1 medications are genuinely powerful tools that are changing lives, but they are also relatively new to widespread use at this scale, and the full picture of their long-term side effect profile is still being written. Clinical trials, while rigorous, capture side effects within defined populations over limited timeframes. As millions of people across diverse demographics use these drugs for months and years at a time, new patterns emerge that were not fully visible in the original trial data. The patient experiences showing up in online communities are playing a real role in bringing less common effects to the attention of clinicians who can investigate them from further and ultimately improve guidance for everyone using these medications. If you are on a GLP-1 and you are itching, you are not imagining it. You are not alone. Rotate your injection sites, talk to your doctor honestly about what you are experiencing, and if the reaction is widespread or severe, stop the medication and seek guidance without delay. If this video was helpful, share it with someone currently on one of these medications, and subscribe so you never miss a video on health topics that actually affect your daily life.